So I'm going to do a glenohumeral posterior glide. So you want to abduct the patient's arm and keep it in the scapular plane. And if you have their knees bent, it'll help take pressure off their back. So you find their acromion, and just inferior is a glenohumeral joint. You want to be cautious because the biceps tendon is pretty tender. So to do a posterior glide, you're going to press posterior and lateral. And you're just going to repeat that a few times, and you're assessing joint mobility and stiffness. And then for treatment, you can just do the same thing, turn it into a mobilization and apply grades. If you come around, still supporting your patient's arm, find the acromion and go to the glenohumeral joint and just apply an inferior glide. And this will be glenohumeral inferior glide. Next, I'll do an glenohumeral anterior glide. So with your patient in prone is the preferred position, but you can also do it in supine. So you'll find the acromion, keep your patient's arm abducted and out. You can support it with your leg and your other arm. So acromion out, and then you find the glenohumeral joint, and you're going to apply an anterior medial glide. Also assessing mobility and stiffness. And you want to be really careful if you suspect an anterior dislocation to make sure you don't dislocate their arm. And for posterior, inferior, and anterior glides, for treatment, you would just turn them into mobilizations and apply grades.